Hey, hi guys, how are you all doing? Nice to see you. Dr. Dan Nightingale here, your clinical dementia specialist. I hope you're all having a good day. I certainly am. I'm enjoying my day. I'm enjoying my week so far. Today's Wednesday and all is good. In northern Arizona, the sun's shining, the sky's blue. What more could I ask for? And as you can see behind me, you know, we're heading into fall here in northern Arizona, just like we are in the rest of the US. So I'm looking forward to some cooler temperatures because it's getting way too hot. What am I going to talk about today? Planning. Well, you know, organization is the key to success. Planning when we are getting older is also a good key to success. You know, we might not have dementia, but what if that is something that happens in the future? It's something that we need to talk about. I think it's important today because we know so much more now about dementia, and because, you know, we're talking more about it, and more or less every single person you meet knows somebody who is living with dementia or who is caring for somebody who is living with dementia. We really need to raise conversations and have more conversation about it, and not be afraid to talk about Alzheimer's disease, not to be afraid to talk about any other type of dementia, not to be afraid to talk about Parkinson's disease or other neurological disorders. As we're getting older, we become more prone to these diseases, these conditions, these disabilities of all kinds. And I think talking about it and bringing up awareness about it is really, really important, because, you know, we end up getting into situations with people living with dementia, like when is it time to stop driving, and when it's time to suggest, recommend that you stop driving or remove somebody's driving abilities, remove their license. Then we fall into all kinds of issues and challenges and problems that could probably be avoided through planning. You know, pre-plan these things, talk about it, think about it, have documentation for whatever it is. So if somebody has a conversation with me and says, okay, if you get to a point where you can no longer drive safely, then I think that's time for you to stop driving, hand over your keys, hand in your license. And I would be happy with that because I don't like driving anyway. But, you know, I'd be happy with that because I can think right now. I'm logical right now. I can think, okay, yes, obviously, if I become cognitively impaired and I'm not able to drive safely anymore, then I do want to stop driving. I don't want to put myself at risk. I don't want to put other people at risk. So yes, you know, that would be something that I would do. And I think for me, we would have to document it and maybe do a little video of an interview. What would you do when you get to the point where you can no longer drive? Well, I would give up my license. I would stop driving. I would hand over my keys, that kind of stuff. Because that's important. It's important to do it in advance. You know, we write advance directives today, living wills. You know, we have those. And so why don't we have something similar when we're talking about a possible cognitive issue, a cognitive decline? We might not get to a point where we have a cognitive issue. We might not have cognitive decline. We might not develop Alzheimer's or any of the other dementias. We might not develop Parkinson's disease or other neurological disorder. We might not. But then again, there's always a chance. So planning, preparing, and ensuring that there is something that can be actually executed at the time is imperative. It's absolutely key, you know, to doing that. And that's the same with other things as well, not just driving, but that is an issue that we do face, a problem that we do face. Another one is knowledge of actually beginning to develop a neurocognitive disorder and then being proactive in dealing with it, just like we would if we felt we were developing a chest infection, if we had some heart disease, if we had our appendix was hurting. You know, we would do something proactive. If we had an infection, we would do something proactive. So let's think about the same thing for people living with dementia. Or if we start to go down that road, think about, what is it I'm looking for? What is it I experience? If I experience these things, then this is the time for me to go and get a checkup. So, memory, short-term memory. If people begin, or if you begin, or I begin to have problems with short-term memory, so I can remember going to a concert in 1986, but I don't remember what I just had for my breakfast or my lunch. That's a bit of an issue. That's a bit of a clue that there might be something wrong somewhere. The second one is if we are disorientated in time and place. You know, if we're not too sure where we are, if we wake up in the morning and think, wow, this is odd. Have you had that situation where you've slept in a hotel or in somebody's house for the first time, and you wake up and you're totally disorientated? You don't know where the bathroom is, you don't know where you're going. Well, similar kind of thing. If you've lived in your house for 40 years, but you wake up and you think this environment's not familiar, then there's a clue that there's something not quite right. And thirdly, not being able to follow a simple procedure, a simple routine, or following a simple recipe to bake a cake, or whatever it might be. Now, bear in mind that there can be other explanations for these things too. A dysfunctional thyroid, I talked about that in a Facebook video today. Dysfunctional thyroid will give you those similar kind of symptoms. Cancer, stroke, heart attack, you might have similar situations and similar symptoms. So get it checked out. If you start experiencing those symptoms, go see somebody. Get it checked out. The sooner, the better. Just like everything else. If it was any other disease or illness, you'd be there getting it checked out. Same procedure, same thing here, okay? Don't let it go, and don't think, okay, well, if this carries on for the next 2, 3, 4 weeks, then I'll go and do something about it. Do something about it now. 2, 3, 4 weeks down the line, too late. Let's do it now. Let's deal with it now. So that's what I want us to think about, the education side of it. Educate yourself. Learn about the key symptoms and what it is you're looking for. And as soon as you start to feel that there's something wrong there, go get it checked out, okay? Don't leave it. Never, ever leave it. So, organisation is the key to success. Planning is the key to success. Plan things out. Make sure that you have a strategy in place for if you do start to develop cognitive decline. If you are already experiencing cognitive decline, then you know that my program, which consists of cognitive behaviour therapy, brain health therapy, and hypnosis, are 3 key things to help with that. Diet and nutrition is the other one. I think we've talked a few times about Dale Bredesen's protocol, which focuses a lot on diet and nutrition, focuses a lot on inflammation and reducing the inflammation and getting rid of inflammation to help ease the symptoms. So that's the program that I implement with my patients and their families. The other thing to think about is if you were prescribed a medication for a chest infection and you were told to take these antibiotics for 10 days, you do it, right? It is exactly the same when you're dealing with brain health. If you're noticing cognitive decline, I need you to do brain health therapy. I need you to do physical exercise, i.e. get in the gym. I need you to look at your diet and nutrition. And I want you to seek help for reducing anxiety and fear through cognitive behaviour therapy, neuro-linguistic programming, NLP, and hypnosis, and get it addressed so that, you know, you're in control. One of the things dementia has the power of doing is diminishing individuals, disempowerment, disenfranchisement. We don't want to see any of that, do we? We want to empower ourselves to take back control. We don't want to have our control taken away. We've talked about how we maintain activities of daily living and instrumental activities of daily living in the past. So we don't need to talk about that right now. But what we do need to think about is maintaining our own independence and maintaining our own self-confidence and our self-esteem and being able to focus on our strengths and the things that we can do, not the things that we can no longer do. So that's just some stuff about planning and organising things and putting yourself in a position of control, in a position of empowerment. Okay? Hope that helps. If you have any questions about anything like that, just send me a message. You can contact me through Facebook, Instagram. You can ask me questions here or make comments on this YouTube channel. Anytime you need me, Dr. Dan at drdanielnightingale.com. Visit my website, danielnightingale.com. Find me on Google. You can find me anywhere. Anywhere. I'm everywhere. I just pop up here, there, and everywhere. So remember, you're never on your own. If you're a caregiver supporting somebody and beginning to drown, let me know. I don't care where you are in the world, because, you know, we have this wonderful thing called telehealth, telemedicine. I can talk to anybody, anywhere, okay? So think about that. And one more thing before you go. And you're going to say it with me, okay? I'm going to count to 3. And after 3, you're going to shout as loud as you can, dump the soda. Okay? Are you ready? 1, 2, 3. Dump the soda! Great, guys. Enjoy the rest of the week. And I will see you next week. Take care. Bye-bye.